Management of Parkinsonism. Parkinsonism is characterized by a combination of rigidity, bradykinesia, a slow movement, tremor, and postural instability. It is due to imbalance between the cholinergic and dopaminergic influences on the basal ganglia. So these two neurotransmitters, acetylcholine and dopamine in basal ganglia, has to be balanced. If their balance is disturbed, so that person can suffer with a disorder or a disease. When the amount of acetylcholine increase or the amount of dopamine decrease in the basal ganglia, it can cause Parkinsonism. So that we have two options to treat this disease: either by administering dopaminergic drugs or drugs which have a dopaminergic activity, or by blocking a muscarinic receptor or drugs which have anticholinergic activity. We have dopaminergic drugs like levodopa and dopamine receptor agonists, and we can have other drugs as well. Dopamine receptor agonist is considered as the first-line drug for treatment of Parkinsonism. In Parkinson's patient, the enzyme which is responsible to synthesize dopamine appears to be in less amount, so that those drugs which stimulate dopamine receptor or dopamine receptor agonists are considered as a first-line drug. Levodopa. Levodopa is a prodrug of dopamine. If we administer dopamine, it cannot cross the blood-brain barrier to act in the central nervous system, so that it is prepared in the form of prodrug levodopa. Now it can simply cross the blood-brain barrier and hydrolyzed by the dopa decarboxylase enzyme that is found centrally and release a free dopamine. But levodopa also, if it is administered alone, it can be hydrolyzed by peripheral dopa decarboxylase enzyme, so that levodopa should be administered together with carbidopa. Carbidopa is a dopa decarboxylase enzyme inhibitor, so that levodopa without hydrolysis, it can reach to the target, to the central nervous system. Antipsychotic drugs. Antipsychotic drugs, also referred to as neuroleptics, which are used to suppress the symptoms of schizophrenia or schizophrenia and other psychotic conditions. The causes of psychosis are not clearly understood. However, the disturbance of neurotransmitters appear to be the cause. Dopamine is particularly important now in psychosis. So those drugs which block dopamine receptor can be used to manage a psychotic problem, especially schizophrenia. There are different hypotheses for schizophrenia: dopamine hypothesis, for example, brain disorder hypothesis, genetic hypothesis. So dopamine hypothesis is important. Drugs which block dopamine receptor appear to be important for management of schizophrenia. The newer agent which blocks serotonin receptors also can be used for psychotic problem or treatments of schizophrenia, like clozapine and risperidone, which are a serotonin receptor antagonists, which are a new agent which are used for treatments of schizophrenia. We have typical and atypical neuroleptics. Say, for example, the typical one, we have chlorpromazine, haloperidol, and atypical serotonin receptor antagonists like risperidone. Chlorpromazine, which is a prototype drug for treatments of schizophrenia, which have a wide variety of CNS, autonomic, and endocrine effects. Chlorpromazine blocks different receptors like dopamine, alpha, histamine receptor, serotonin receptor, so that among these receptors, dopamine receptors appear to be important for the treatment of just schizophrenia, blocking dopamine receptor. So the clinical use of chlorpromazine is used for treatments of schizophrenia, mania, vomiting. If you remember, there are different neurotransmitters which are responsible for nausea and vomiting. Dopamine is one of the neurotransmitters. Those agents which block dopamine receptor like metoclopramide and chlorpromazine, what we are discussing now, are used for treatments of vomiting. The other important thing is the adverse drug reactions of antipsychotic drugs, extrapyramidal reactions. Most antipsychotic drugs and other drugs can have an adverse drug reaction known as extrapyramidal reaction. It is also called movement disorder, which is characterized by seizure, tremor, muscle contraction, unable to walk or walk disorder. The other adverse effects of antipsychotic drugs is like orthostatic hypotension. Chlorpromazine, which is a prototype antipsychotic drugs, which can cause orthostatic hypotension because chlorpromazine block alpha receptor. It has also metabolic and endocrine effects, so that it has a weight gaining effect as an adverse effect. The other drugs are antidepressants. The common signs of depression is change in mood and behavior, feeling of frustration and hopelessness, decreased appetite, and difficulty in sleeping. We can have exogenous and endogenous depression. Exogenous depression is, say for example, when someone loses his family, so that the exogenous one can be managed by understanding and psychological treatment of his family. Whereas the endogenous depression is due to disturbance of neurotransmitters. So in some cases of depression, there are an alternative period of mania and depression. Mania is hyperexcitability and elation, which is an excessive happiness during mania. Mania and depressions have a different or opposite symptom. Mania, say for example, when someone is manic, he becomes hyperactive, highly involved, say for example, some inflated self-esteem, and so forth. But the depression one is the opposite of that of mania. Say for example, during depression, the patient withdraws himself and he wants to sleep but is unable to sleep. So a patient can have both mania, an alternative cycle of mania and depression. This is what you call it mania depression or bipolar mood disorder. So here, the neurotransmitters which are involved in depression are norepinephrine and serotonin. When the level of norepinephrine and serotonin decrease, then which is associated with depression, and when the level of norepinephrine and serotonin increases, which is associated with mania, the same person can have both depression and mania in what we say mania depressions or bipolar mood disorder for this problem. So we have different types of drug for treatments of depression. TCS or tricyclic antidepressant like imipramine and amitriptyline, say for example. Monoamine oxidase inhibitors. Tricyclic antidepressant inhibits the uptake of serotonin and norepinephrine in nerve terminals so that the level of norepinephrine and serotonin can increase in the CNS. This is the mechanism how they treat depression, since depression is decreased in level of serotonin and norepinephrine. Monoamine oxidase are an enzyme which is responsible to hydrolyze amines, because norepinephrine, serotonin, these are amines. So now monoamine oxidase inhibitors inhibit this enzyme, then sustainably increase serotonin, norepinephrine, and dopamine. Since it sustainably increases these neurotransmitters, these drug, monoamine oxidase inhibitors, are used for severe depression or for depression which cannot be effectively treated by other antidepressant drugs or refractory to other antidepressant drugs. Selective serotonin reuptake inhibitors and atypical antidepressants are the other antidepressant drug. So the other important thing is the pharmacokinetics of these antidepressants. Most tricyclics, TCS, are incompletely absorbed and undergoing significant first pass metabolism. TCS are the most widely used antidepressant. As I discussed, they inhibit the uptake of norepinephrine and serotonin. TCS also actions on different receptors like alpha receptor, muscarinic, histamine, serotonin. So tricyclic antidepressants can be used for different psychotic problems. It is also used for bedwetting in children. This is due to the anticholinergic effects of TCS. I have discussed about TCS, which can block different receptors, including muscarinic receptor. So when it blocks muscarinic receptor, that's what we call it anticholinergic effect. So if you remember, anticholinergic just have an effect of relaxations of detractor muscle and contractions of internal sphincter. Due to this mechanism or effect, TCS can be used for treatments of bedwetting in children. The others are MAO inhibitors. They are used for severe depression because they are sustainably increase serotonin and norepinephrine as well as dopamine. So they are used for depression which is refractory to other treatments. The adverse effect, TCA and MAO inhibitors cause atropine-like effect. As you know, atropine is a prototype anticholinergic drug. So TCS and MAO inhibitors, since they have anticholinergic effect, since they block muscarinic receptor, they have atropine-like effect. So you can refer back the adverse effects of anticholinergic drugs. And they have also postural hypertension because both drugs block alpha receptor. When alpha receptor is blocked, postural hypertension can cause as an adverse drug reactions. The other, MAO inhibitors cause excessive central stimulation because it sustainably increase the monoamines as I have discussed. And since they have endocrine effect, they have a weight gain effect as an adverse effect.